Kawasaki disease, KD, 5-year-old and below, kids, common to boys. What else? Etiology is autoimmune. So it's also known as what? It's also known as mucocutaneous lymph node syndrome. Mucocutaneous, skin affectation as well, and a lymph node affectation apart from your mucocutaneous or skin. From the word itself, autoimmune disorder. It's an inflammatory response to your what? Particularly to your medium to your large vessels. I'm going to pay particular attention to your coronary artery as part of your medium blood vessels. So I'm going to focus on your coronary artery because that's the complication that we don't want to happen, that we need to prevent. It's an autoimmune disorder which is usually affecting the boys of less than 5-year-old. Autoimmune, guys, most of the time it's female. There are some autoimmune disorders that also affects the male population. But again, most of the time, like 60 to 70% is usually like female. Just to give you at least and added information about autoimmune disorder. So basically, an autoimmune disorder is what? An immune response. You know, autoimmune. Your own immune cells are killing your tissues or causes inflammation to your tissues by producing certain antibodies that will promote inflammation. So that's autoimmune. That's Kawasaki disease, or also known as mucocutaneous lymph node syndrome. Just remember these mnemonics. What's the mnemonics here? So anyway, again, as I've said, we'll focus more on the rationale. We can also answer that question. So this is your crash and burn. Remember the mnemonics, crash and burn. So this is fever. That's your burn. Fever that is not relieved by what? By antipyretic. So what about this crash mnemonic? C means what? Conjunctivitis. Letter R is rash. Later on, it will promote all throughout the body and it will promote desquamation. This is unique about your Kawasaki disease. What about this one? Adenopathy. That's why it's called mucocutaneous lymph node syndrome. Adenopathy, particularly to your what? Cervical lymph nodes. So this is your strawberry tongue. This is what I'm telling you. This is also present in your what? In your scarlet fever or streptococcal pharyngitis. Strawberry tongue. And this one is hands and feet swelling. How many criteria do we need? 4 out of 5 plus your fever. This is your crash and this is your burn. Crash and burn. Don't forget it. Again, this will promote desquamation as well. If you want to look at the phases, your acute, your subacute, and your convalescent. The word itself, convalescent, there's no symptoms, no signs and symptoms. When you say acute, there's symptoms, of course, fever. You also have your hyperemia. And then your subacute is your desquamation. Remember? It begins from rashes, red rashes, that's hyperemia. And later on, when you are on your subacute phase, it will desquamate. Okay, what's your question about again? Let me see. Cracked lips, normal appearance, that's convalescent. On acute stage, it's not cracked lips, normal appearance, conjunctival hyperemia. Desquamation is subacute. Cracked lips is also subacute. Normal appearance is convalescent. No signs and symptoms. So these are your phases of your Kawasaki disease. Let's move on to your diagnostics. Ano nga ang kinukuha natin? If we have like autoimmune disorders, chronic inflammatory disorders, CRP, and your ESR. Elevated, CRP and ESR. Of course, clinical signs and symptoms, crash and burn symptoms. Management, next step, this is IVIG, immunoglobulin through IV, and high doses of your immunoglobulin, and as well as your aspirin. Remember, aspirin can cause Reye syndrome, which can promote what? Encephalopathy from your liver, and then it will promote brain encephalopathy. But the thing is, remember, ASA is an antiplatelet. This is to prevent complication from happening. What about the complication here? Again, it outweighs the complication of your Reye syndrome when you give ASA. That's an excuse for a kid, for a child. So that's a drug of choice. This is your blood vessel. As I've said earlier, coronary artery. This is your coronary artery, cross-sectional. Platelet. That's your primary hemostasis. And then fibrin. As we all know, fibrin is not dissolved easily unless if you give what? Streptokinase. So this kind of a thing will happen in a case of your Kawasaki disease because this is, remember, this is autoimmune disorder that promotes what? Inflammation to your blood vessel. If there's any inflammation or injury, there you go. There's the platelet. They will migrate to the area and it will promote what? Secondary hemostasis. When you say secondary hemostasis, that's your coagulation cascade. And the byproduct of your coagulation cascade, I'm going to discuss to you next part. The byproduct of your coagulation cascade is basically what? Fibrin. You don't want that to develop because fibrin is not dissolved easily unless you give like thrombolytics. This is your fibrin. What will happen? This is a clot formation. So that's why it can cause what? It can cause AMI, acute myocardial infarction, among these individuals. So that's something else. That's why it's a complication. Apart from AMI, it can cause aneurysm or coronary aneurysm. So what will happen? This is your heart, not necessarily you have injury here because of an autoimmune disorder promoting inflammation, a chronic kind of inflammation. What's gonna happen? It will promote, there you go, there's your, it will distend, it will promote formation of your what? Aneurysm, outpouching of that blood vessel. 8 millimeter, it can rupture. If it ruptures, that's a problem. Remember, this is a coronary artery. 8 millimeter coronary aneurysm. Remember this number. So it doesn't necessarily cause or to create clots formation. That's one thing also, your aneurysm. And if it create clots, that's another problem, which is your AMI. That's another complication. So that's why you need to give ASA or aspirin to promote antiplatelet mechanism to prevent your AMI. Why do you use IVIG, high doses? And NCLEX tip here, IVIG can cause fluid retention. The patient or the kid or the Kawasaki disease patient can have swelling because of IVIG. Increased retention of your sodium and water. So that's one thing. Why do you give IVIG in your patient with autoimmune disease like this? The principle is like this. You have an active antibody here causing inflammation. So these are your antibodies that are very active in causing inflammation to this, for example, coronary arteries, medium to large blood vessels. So you give IVIG to basically, antibodies, stop it, I'm here, to halt the production of your antibodies. And these antibodies will not attack your what? Your blood vessel. Just enough to tell your bone marrow, more specifically, to halt the production of your antibodies from your plasma cells. Because, plasma cells are the ones who will produce your antibodies from your bone marrow. Of course, we're going to discuss that in your hematopoietic discussion. So again, don't forget, complication is your AMI and coronary aneurysm. And that talks about the heart. Large doses of IVIG is given to halt the production of your autoantibodies. And aspirin is antiplatelet, regardless if it causes the Reye syndrome, because it outweighs the risk of causing a heart Reye syndrome. Give an antiplatelet like your aspirin. Okay? So